Hi, Dr. Doreste with the Cranial Release Technique, and I'd like to spend a moment with you just speaking about something that I observe all the time. I'm here in Miami Beach. It's March 16. A lot of people down here now on vacation, getting ready to go on cruises, spending some time down here. It's beautiful weather, 80 degrees, the sun is shining, and everyone is so stressed out. And they're stressed because of things that they're aware of and things that they're not aware of. So in the cranial release technique, we talk about the 4 types of stress that really we're all subjected to, but is made worse by a cranial distortion. And I'll speak about that in a moment. So as I'm walking around the streets and watching the people here, physical stress, chemical stress, emotional stress, and again, those are the ones that most people know about. And now the new one, the EMF, the electromagnetic frequency stress. What's coming out of the cell phone? What's really happening when you're in a Wi-Fi environment, which is basically everywhere now? And in addition to that, the cranial distortion. So what do I mean by that? Well, when I'm walking around or sitting having a coffee and watching people as they walk by, what you'll notice is one of their eyes is more closed than the other, the right versus the left. One of those eyes will be lower than the other in the head, the right versus left. And it doesn't have to be very dramatic, and sometimes it is. So one eye small, one eye low. The ears will be rotated. There'll be distortion in the cranium that you can visibly see. That's osseous or bony distortion. That is going to lead to a mechanical tension on the central nervous system, which is the brain. So remember the brain, which has the consistency basically of jello, encased in this bony house, which we call the skull or the cranium. And now the cranial bones, the 22 cranial bones shift, rock, tighten down. And then this person is under the physical, the chemical, the emotional, and the EMF stress. Whether they have symptoms or not, it doesn't matter to me. It doesn't matter to a cranial release technique practitioner. What matters is that patient functioning optimally? And there's no way that you can function optimally with a distorted cranium. So as I'm watching these hundreds, if not thousands of people walk around, I know that if I did some of my simple tests on them, they would all fail. One leg would be shorter than the other. One leg would be tighter. There would be more tension in the musculoskeletal system from one side to the other because of the cranial distortion, which is then impacting the neurology, the brain, which is telling the muscles how tight or how relaxed to be. So the beauty of the cranial release technique, I don't have to work at the site that you're complaining about, whether that's your foot, your ankle, your knee, your hip, your back, your spine, your shoulder, your elbow, your wrist. What I need to do is unlock and allow these 22 cranial bones to open and start to move again, move normally, which is normal and natural. When that happens, the brain, the way I see it is the brain sort of says, thank you very much, I needed that. Now I can control and coordinate all the functions in the body that I'm supposed to be doing, and and that the brain is in control of. We just want to optimize function at every level of the patient's body. Physically, chemically, emotionally, socially, spiritually, endocrine system, autonomic nervous system. How well is the sympathetic, parasympathetic balance? Well, if you're relaxed and getting ready to go on a cruise and you're down here for vacation, in theory, you should be in parasympathetic dominant. Nice and relaxed, healing, repairing, regenerating, not in stress and tension and ready to fight or flight mechanism, which is the sympathetic, which virtually everyone is stuck in sympathetic. So to wrap all this up, as you go through your day, just start to look at patients if you're a practitioner, friends and family if you're not. Look in the mirror. You'll probably notice cranial distortion. If you see cranial distortion, 100%, there's no way you can be optimized from a neurological standpoint. So see a cranial release technique practitioner. Visit our website, cranialrelease.com. Find a practitioner. Hopefully there's someone in your area. If you are a practitioner and you would like to learn more about this work, then please visit my website at cranialrelease.com. There's a button that says online training. You can click that and learn more about how do you learn the cranial release technique in the comfort and privacy of your home or office. This is Dr. Doreste with the cranial release technique saying thanks so much for spending a few minutes with you here from Miami Beach, Florida. If you haven't already, you might want to click that subscribe button so you stay in touch with me when I come up with some new ideas, as well as you could hit the like button or comment below if you have any questions or comments. I'd be happy to hear from you. Thanks so much, Dr. Doreste signing off. Cranialrelease.com. Adios, my friends. Ciao.